very warm welcome to everybody who's joining us today at whatever time of day it is for you. It's really lovely to see lots of friendly faces, and I'm sure there'll be people watching back on the recording as well, so a very warm welcome to them as well. We're sorry that you can't make it live. Oh, sorry, bear with me, there's somebody else coming in. So bear with my multitasking here. We're really excited to be chatting to you all tonight. I know there's a whole mix of people here. The title of this, we're calling it, long COVID athletes, but actually in terms of long COVID, everybody kind of comes under a similar umbrella. So although we may have been tailoring this a little bit more to people who might be more active, I think actually things are absolutely relevant to everybody here. So please don't feel like this isn't relevant to you just if you didn't class yourself as an athlete. Everybody is very, very welcome. I think just before we get started, a tiny bit of Zoom housekeeping. If you can keep yourselves muted, that would be wonderful, just to cut down on the distortion and stuff. But feel free to chuck stuff in the chat if you would like to. And of course, this is being recorded, so if you don't want to appear on camera, then you're very welcome to turn your cameras off if you feel more comfortable doing so. We will be taking questions at the end, so we'll give you a chance to shout them at us after we've kind of been through our presentation. So I think that is hopefully everything I need to say at the start, and we can kick off our presentation. So over to you, Vikki.
All right, well, thank you everyone for joining us. My name's Vikki Jones. Just going to share a little bit about myself and my journey and why I'm here to share what I've learned about breathing. I'm actually a 39-month long hauler, still exhibiting symptoms. Today, I can honestly say is not my finest. So if I appear a little foggy, it's just because it's just one of those long COVID days. But prior to getting COVID, I was a personal trainer, a dietitian. I was an international athlete when I was young, but I have always been involved in multi-sports. I was an endurance athlete, and I really considered that I was a strong, fit, healthy person. But I was also a dysfunctional breather, or I learned that I was a dysfunctional breather. And I know we're all in this together. When you get long COVID, you just start looking for answers. You have to doctor yourself. That's why these support groups are so amazing. And I was introduced to a couple of breathing programs because I had such terrible breathing difficulties. And they actually compromised me, and they made me worse. But the part of me that's the personal trainer realized that there was something about breathing that would be helpful for the long COVID sufferers, and it would be helpful to me. So I reached out to Patrick McEwen, who is the founder of Oxygen Advantage and the International Butico Clinic. And he was the first person that actually listened to me. He was curious, he was compassionate, he was willing to modify the stuff that his thoughts of long COVID were. And I worked with him, and a lot of it was trial and error, but we came up with an arsenal of exercises that would be suitable for people with long COVID, and also people that were long COVID sufferers that were endurance athletes. So right now, I coach people with long COVID, ME, CFS, golfers and athletes. And Jen and I are very proud that we get to mentor those who coach sufferers of long COVID. So we are sort of the we're the go-to people if some of the instructors have questions about long COVID breathing exercise. And one of the things that's made huge difference to me. I think when we get long COVID, we all lose a part of our life, and the part of the life of my life that I lost was exercise, and I wasn't able to do it. And it was very difficult. It made me very depressed. And knowing that this breath work helps me with my long COVID symptoms, but also knowing that this breath work is going to help me when I can get back to my full fitness, which I will, but I'm going to be a stronger, fitter athlete when I recover. So a little bit about me, and I'm going to pass it on to Jackie now.
Thanks, Vikki. I think a lot of what Vikki has just described in herself is a lot of what I would have seen myself as before I got long COVID. I was a sort of very active, I would have called myself a completely fit, healthy, active person, and was kind of like surprised when I got COVID and then didn't get better. It seemed like a bit of a surprise to me because, you know, on paper I should have been fine. But throughout this journey, you know, I've always been a person to look for answers, which is why I started the Long COVID podcast. And looking into it, realized that although I was very fit and very active, I actually wasn't as healthy as I might have liked to think. And one of these discoveries was that I was a dysfunctional breather. I almost certainly was before I got COVID. And then when I got COVID, that obviously exacerbated things to a level where I actually couldn't function at all. So I'm not going to dive into too much detail about all of that, but I have now come out the end. I'm now recovered. And one of the things that helped me so much on this journey, in fact, the first thing that I found that helped me was breathing exercises, was retraining my breath pattern completely, because as it turns out, you can breathe wrong, and then actually using the breath to influence my nervous system alongside other things as well. And that was a huge part of my recovery, which is why I think it is so important to get this information out there, but in a way that is appropriate for people with long COVID, who are not sort of bog standard people, which is a terrible phrase, isn't it? So yeah, that's me. And actually, I do now consider myself to be a healthier person, as a result of having to, well, fix all the things that weren't quite right, including the breathing. So yeah, that's me. And handing on to Vikki again.
Okay, well, I thought what we'd do is we'd start this session with a little bit of nasal breathing. And prior to doing nasal breathing, I just want to have a caveat to say that if you don't feel comfortable with any of this, please don't do it. If today's a bad day and you're not feeling up to this, or if state of heightened anxiety or panic, just listen. As instructors, our thing is to do no harm. So we don't know you as individuals, but we're just trying to put some information out there, let you feel some things that we're trying to teach. But I'm going to invite you just to do a couple of minutes, maybe it might just be one, a minute of nasal breathing. So if you are in that state where you would like to join me, I would like you to just put your finger across your lips and relax your shoulders and kind of reduce the tension in your body. Close your eyes, and if you're sitting, please put your feet on the ground and sit up nice and tall. And start breathing in your nose and out your nose. So inhale through your nose and exhale through your nose. And I want you to do this at a pace that feels good to you, feels like that's your breath timing. So when we breathe in through our nose, we should feel our belly expand. And when we feel when we breathe out through our nose, our belly should contract. And what you're doing here is you're actually activating the vagus nerve, which is your parasympathetic nervous response. And it's going to help calm your mind and calm your body. So just keep breathing through your nose. Exhale through your nose. Probably right about now, your mind is wandering, thinking about, what am I doing? Bring your attention back to your breath. So almost visualize that breath going in your nose and out of your nose. And if you feel comfortable, just focus on the different parts of your body. So maybe focus on your hand, focus on your foot, and keep your mind on your breath. So one of the things about nasal breathing is it's an amazing way to calm our minds, to calm our body, and to get in touch with what's actually going on. So right now, hopefully you're feeling a little calmer. You can open your eyes, take your finger away from your lips. And when we talk, whilst we're talking, just check in. Try to carry on doing this while we're talking. So keep your nasal breathing going if that's something you feel comfortable doing today. And then we'll just keep checking in and remind you, what are you doing right now? So I'm going to pass it back to Jackie.
Thanks, Vikki. So I'm certainly feeling slightly more relaxed after focusing on my breath for a few moments there. So hopefully you are as well. So yeah, while you're all hopefully feeling more relaxed and doing some lovely nasal breathing there, I'll just take you through what we're actually going to do today. So we are going to look into how to functionally breathe, as well as why breathing as a therapy helps long COVID symptoms. So these are the two things that I was talking about earlier: fixing your breathing so it actually works, and then using that to influence your nervous system. And then why functional breathing helps improve movement. And what we're going to do is we're going to put a little bit of a caveat on movement. We're specifically not using the word exercise here, because that's a very loaded word. So, you should not be exercising your way through long COVID. I think we've probably all worked that out, some of us the hard way. I know I did. But, movement is important. Movement's important for everybody. And movement will mean different things for different people on different days. So, some people may be able to get out and do some form of movement that they might even call exercise. And for some people, on some days, your marathon will be the shower. And, that is unfortunately the way of long COVID. But what we're talking about here, movement, it may be lying in bed stretching on some days, or it may actually be able to get out the house and go for a walk or do something like that, and everything kind of in between. So we're in no way suggesting that people should be pushing themselves beyond what their bodies are allowing them to do. In fact, that's the opposite to what we're saying. Your movement is very, very individual, and you need to work that one out yourself. But what we are going to talk about is why breathing, the better we breathe, the more efficient our bodies are going to be working in order to be able to move. We're also going to take you through a few exercises to get you started. And we're going to talk about sleep and breathing, which is a huge thing. And then, of course, everyone's favorite word, pacing. How do we pace ourselves with these exercises on top of everything else? Because what we don't want to be doing is putting ourselves through breathing boot camp, because we kind of know what happens when we do that, don't we?
Okay, so we all have to have goals. We're probably very goal oriented, but the goal of this talk is to establish full-time nasal breathing. So one of the big takeaways, or what I call a little win, would be for you to understand why it is important that throughout your day, you are using your nose to breathe, i.e. keeping your mouth shut, 100% of the time, unless you are talking and eating. So that's one of the goals. The other thing I think we sometimes forget to talk about is if we've got our mouth shut, where should our tongue be? So we're going to do another little exercise because I'm all about exercise and movement of the tongue. So the correct tongue posture while you've got your mouth closed is at the top of your palate. So if you close your mouth, and we're going to all do this together, don't feel embarrassed, you are going to make that popping sound that you used to do as a kid that irritated your parents. So you'd walk around, and when you make that pop and your tongue hits the top of the roof of your mouth, that is the correct resting posture of your tongue. So just give that a go, make some noise, and then rest your tongue up there. One of the questions that we do get is, why is this important? And one of the reasons it's important is over the years, our faces have changed and our mouth has become smaller. When we have a smaller mouth, it's a lot harder to functionally breathe. So when you put your tongue on the top of on the roof of your mouth, you're opening up your airways, you're opening up your palate. So the other thing we're going to keep talking about is how nasal breathing will improve your sleep. It's so important. It's one of those things that we are, the buzzword for performance, for recovery, is getting a good night of sleep. And I know Jackie's going to talk a little bit about how long COVID affects that. But if I can tell you one thing, I will say that if you can nasal breathe during the day, you are more likely to be able to nasal breathe at night. So this is all wrapped up into why we are doing this. And then finally, I'm going to be introducing nasal breathing into your movement patterns, why this will help movement, recovery, performance, and how it functionally sets up our body for being the best that it can be.
Okay, so what is long COVID? I don't think I need to insult anyone's intelligence by going into that too much. We know that long COVID is real, no matter what certain doctors, friends, family members, and employers may have tried to tell us. And long COVID is also a trauma. So trauma can be described as when our world as we know it is changed without our consent. And I don't think any of us asked for this. So I think that probably just about covers it. What long COVID also does is disrupts our autonomic nervous system. So dysfunction of the autonomic nervous system, also known as dysautonomia. Dysautonomia, which is not just POTS, which is what a lot of people might have been told. So any sort of dysfunction of the autonomic nervous system, and the autonomic nervous system being the system that basically controls all of the automatic functions. And I know Vicky's going to talk a little bit about that later. So our autonomic nervous system has been disrupted, which is why we have all of these sort of seemingly different symptoms. But people with long COVID can feel all of these things: scared, anxious, let down, misunderstood, unsupported, depressed, frustrated, hopeless, unseen, and unheard, all traumatizing. what we also have, we're frustrated that our lifestyle that we may have taken for granted before, but our lifestyle is no longer what we knew. The rug has been pulled out from under us literally overnight. So being able to work, being able to spend time with friends and family, being able to exercise, all of these things, we can't do them anymore, or we certainly can't do them in the way that we did. And it sucks, for want of a better word. Um, so yeah, moving on. So trauma can basically make our bodies much more sensitive to all sorts of things. So all of these stressors, so our autonomic nervous system, when we get, we call them triggers, getting triggered by all of these things that are seemingly not particularly a big deal, suddenly they are a big deal for our bodies when we have long COVID. So our bodies will be in this fight or flight response, and this is where we're going to get in our breathing things like fast or irregular breathing, shallow upper chest breathing, hard breathing, mouth breathing, things like sighing, potentially being more prone to things like panic attacks and anxiety, and fast heart rate, which is linked to all of these things because our breathing and our cardiovascular system are very linked. So, when our body experiences trauma, we're going to see all of this. What we might also see is the other side of that, the shutdown freeze side of it. And that's where you're going to get your sort of super duper chronic fatigue kicking in, where the body just shuts down. And, these are all the things that you might see in your breath pattern when you're stressed. But when we have long COVID, we are stressed all of the time. And we're not just stressed, we are all of the other things as well, which is why, stress on top of long COVID is not a particularly good combination. So, we would even call it a trigger. So, our breathing pattern, when we're seeing all of these things on the screen, is going to prevent functional movement.
Okay, so we're talking, Jackie just brought in that big word, dysautonomia, autonomic nervous system. I think it's something that before long COVID, we all took for granted. We all took for granted the fact that our body could digest food, that our heart rate was normal based on activity level. Our hormones worked, our blood pressure worked, the temperature of our body was stable, and how the autonomic nervous system, when it goes awry, how it affects our energy levels, how it affects our ability to recover, and how it actually affects our ability to move. So these are all things that things that we took for granted that we could do have now been taken away from us. And I'm putting to you that the only part of this autonomic nervous system that we have any control over is our breathing. And that's why it is so important. It can stabilize our body, and it can change our biochemistry. So all the things that happen within our body that we take for granted, breathing can affect that. We can make our body more acidic. We can make it more alkaline by changing our breath. You can also change the state of your mind by changing your breathing pattern. So it is a skill that we need to learn for long COVID. It's so important because it can help get you through some pretty rough days. But it's also a really important skill that you learn if you're going to be healthier and moving more during either your recovery or after long COVID. So that's why breathing, learning to breathe properly, learning to breathe functionally is so very important. So before we just move to the next slide, just going to touch on the difference between the parasympathetic, which is the rest and digest part of your autonomic nervous system, and the sympathetic, which is the fight or flight. So the parasympathetic really takes control of salivation, your heart rate slows down, your digestion goes on, and reproduction occurs. So that's very calming. And then the fight or flight, or the sympathetic, is the your heart rate increases, your saliva decreases, and your ability to digest food slows down. Your kidneys will pump out adrenaline, your reproduction slows down. But it's what we need in a time of stress. But unfortunately, with long COVID, we are stuck in that sympathetic state, that fight or flight system. So the balance, if you think of it as a seesaw, or as a, I don't know what, a seesaw, we're out of balance. And that's where the breathing exercises will rebalance our autonomic, or the parasympathetic and the sympathetic. So the big takeaway from this is that we can use breathing to rebalance our sympathetic, which is turned on all the time in COVID, versus our parasympathetic, which helps us calm, recover, sleep, digest, and actually feel better.
Okay, so just before we kick off with this slide, I'm going to invite you just to check in with your breath. While we've been talking, are you still breathing through your nose, or have you possibly gone back to breathing through your mouth? Just have a quick check in with yourself while I tell you the differences between mouth breathing and nose breathing. So breathing through the mouth, otherwise known as dysfunctional breathing. So our mouth breathing is going to kick us into our sympathetic response, so our fight and flight response. It's going to accelerate our breathing. So if we're feeling our breathing starting to get faster, then it's very likely that we're doing it through our mouth. It's going to encourage upper chest breathing. So kind of very, very chesty breathing, where we're not getting that breath all the way down into the bottom of our belly. It's also going to increase dehydration. So you're going to lose a lot more moisture out of your mouth. So if you feel like you're constantly dehydrated, it's possible that you are breathing through your mouth. Also, well, I just said that, didn't I? Drier mouth, and also poorer oral health. So our mouth is not for breathing, it is for talking and eating, probably not at the same time. So our nose, if we're breathing through our nose, we are much more likely to be functionally breathing. Our nose is going to stimulate our vagus nerve. So that's a word that we've probably all heard. Vagus nerve, which is related to our parasympathetic response, our rest and digest. And that's where we want to be, because that is the body's healing response. If we're breathing through our nose is linked to diaphragm, and diaphragm breathing is going to enable us to get the breath right down into the bottom of our lungs. So we want to be diaphragm breathing. We're going to talk more about that later as well. If we're nose breathing, we are going to be breathing slower. So none of this sort of fast, shallow breath. The nose also sterilizes the air that we're breathing in. So, there's a lot of talk about air quality. Yes, air quality is important, but we can improve that just by breathing through our nose. And also by breathing through our nose, we are going to utilize the nitric oxide, which is an antiviral. And I don't think I need to insult your intelligence by telling you why that's important. Breathing through our nose is also going to control the temperature and the humidity of the air. So that feeling when we go outside and it's a really cold day and we breathe through our mouth and it makes us cough. If we breathe through our nose, the nose is going to control, will certainly be able to influence the temperature there. And breathing through our nose is also going to help control more of the hormonal symptoms. So those who experience periods, for example, are going to be able to control that much, much better related to that by breathing through our nose. So hopefully you are all still breathing through your noses, because it's brilliant. So noses are for breathing.
So I'm just going to go a little bit into this functional breathing pattern and how it helps with movement. So as we said, we don't want to talk specifically about exercise, but if you are someone that has a focus on movement, some of these things are going to gel with you. So when we functionally breathe when we're moving, actually this also applies to long COVID, of course, but it improves our blood circulation and the oxygen delivery to cells. So think about walking and how you want that to be happening. It reduces the onset of breathlessness. So if you can train your nose as your breathing apparatus, then when you do bouts of endurance movement, you are more likely to, it will take you a lot longer to get breathless. Bronchoconstriction is actually another name for asthma. So some of us have exercise-induced asthma. If you can learn to breathe, functionally breathe, it will reduce that. It also increases your heart rate variability. Heart rate variability, vagus nerve, parasympathetic, these are all the buzzwords of long COVID, but they are also the buzzwords of functional movement. So we've all got devices now that, well, devices are available where we can monitor our heart rate variability. And if we can employ some breathing exercises, then we can increase our own individual heart rate variability, which then helps you, I've lost the word, your ability to deal with stress. So functional breathing is also going to help your sleep, your focus, concentration, and calm. One of the things that when I coach my athletes is functional breathing and sleep. Sleep and movement. It is so important that, and sleep and long COVID, it is so important that we sleep well, because that's the time that our bodies recover. And if we're not functionally breathing during the day, it is very difficult for our bodies to suddenly learn to functionally breathe at night. The other thing about functional breathing is how it influences our spine and our core stability. So I'll talk about that a little bit more. And obviously, the stronger our core, the more that we reduce the risk of injury. So whether and long COVID often brings about a decrease in our ability to move, but we also feel very sore because we're sitting a lot and we're tired a lot, or we're lying down. And when we're not moving, that's not a good thing. But also, if you're not moving your diaphragm when you're breathing, then you're more likely to feel like you're just stiff. You don't feel great. There's a bit more pain. So those are some of the functional breathing positives that we talk about when we are teaching breathing. Okay, so one of the things we're going to do in a minute is we're going to do some diaphragmatic breathing. So your diaphragm sits right underneath your lungs, and it looks a little bit like a pizza, and it's a muscle. Okay, so I'm very conscious that when I teach that you are able to understand what we're actually trying to do. So deep breathing needs to, the word deep needs to replace that big breath that we were taught so many times. It's like, if you're having a panic, take a big breath. We don't talk like that anymore. We're talking deep. So if you can imagine deep sea diving, we're getting down. So this breath, deep breathing, diaphragmatic breathing, you are moving the air through your nostrils down into your diaphragm. And research has shown that this deep breathing will increase your lung volume. That's good for long COVID. That's good for people that are moving a lot. It increases ventilation perfusion, which just means that when you breathe deeply, when you breathe into the bottom of those lungs, then the gas exchange improves. And the bottom of our lungs often don't get that air. And guess what? If you don't use it, you lose it. So this is a really good way of stimulating the alveoli that are in the bottom of the lungs. You get increased oxygen uptake in the blood, increased spinal stabilization, which is so important for movement, also recovery for people that have been sitting. Movement patterns, lymph drainage. Your lymph system is actually a shuttle. It kind of cleans the rubbish that's going on in your blood. The lymph system is that shuttle. So we want improved lymph drainage, and breathing does that. We've already stated that it calms your mind and helps increase focus and concentration. So now we are going to, if you feel able to, I'd like to just talk you through a diaphragmatic breathing exercise. Once again, if you don't feel up to this, please don't do it. But we've been talking about how this breathing helps improve functional movement. So this is what we're going to do. You can sit, and that's how I'm going to teach it right now. But this can also be done lying down or walking. This exercise is going to stimulate your vagus nerve, and it's going to allow all that air to get to the bottom of your lungs. And hopefully you'll notice that your breathing is going to slow down. So the other things I've already touched on, it helps with backache, posture, and helps calm the mind. So what we're going to do is we're going to sit, and I'm going to invite you to put, I'm going to stand up just very quickly. I'm going to invite you to put your hands on either side of your rib cage. Now, if you're like me, I wear actually a chest strap to monitor my heart rate. And actually, I feel that like this is a really great breathing tool because I can feel it moving when I'm diaphragmatic breathing. So what we're going to do is we're going to put our hands on either side of our rib cage. And the focus is that when you inhale through your nose, you allow that your rib cage to expand. And when you exhale, your rib cage is going to contract. So just while you're sitting, put your hands on either side of your rib cage, and we're going to inhale through our nose and see if you can't feel those fingers moving out. And then when you exhale, your fingers are going to move back to that starting point. So you're breathing, inhaling through your nose at your own rate, allowing that air to fill that diaphragm. That diaphragm is actually moving down and producing inter-abdominal pressure. And then when you exhale, the diaphragm is returning to its starting point. So I just want you to continue to do this breathing. So you've got your hands on either side of your lower two ribs. So bring that air into your lungs and try to feel your ribs expanding. And as you breathe out, feel your ribs moving inwards. So it actually takes pressure to move those ribs, and that's what you're doing. Your breathing should be very quiet. And obviously I've told you to breathe at your own rate, but keep your breathing quiet. And work on that inhale, allowing your ribs to expand. And then exhale, feel your lower ribs moving inward. So what you're doing here is you're actually stimulating your vagus nerve. And you're also stimulating that parasympathetic nervous system. So I'm just going to allow you to continue to do this if you feel comfortable for just a few more breaths. There's no need to hear those breaths. Keep it quiet. This is a great exercise to do if you go out for a walk. Just to put your hands or to wear your chest strap and feel that air going into your lungs, going into your diaphragm, and then allowing those hands to return or contracting again. So that is your diaphragmatic breathing exercise. So you can open your eyes. And I think Jackie is now going to put you all to sleep.
Yeah, hopefully not literally, or certainly not until we although I guess that would be quite a compliment actually if we did. So yeah, sleep. I think this is something that can certainly be a huge issue for people with long COVID, which can cause a massive disturbance in our sleep pattern for all sorts of reasons. And certainly for me, in my experience, when you can't sleep on top of everything else, it really just makes a bad situation into something that's almost intolerable. And as we talked about earlier, sleep is where our body is going to do a lot of its healing. And if we can't sleep, then we're kind of losing out on that. So sleep in long COVID, or sleep problems in long COVID, can manifest themselves in a couple of ways. So the sleeping too much, where we just sleep and sleep and sleep and sleep for 16, 17, 18, 19 hours, but we generally don't feel rested after it. So much sleep, but just not getting anything from it. Or can't sleep at all. So the horrendous insomnia that I'm sure some of us have experienced, and it can just go on and on and on. And, a person without long COVID would feel pretty awful if they weren't sleeping. But when you add long COVID onto that, it's just utterly horrendous. And personally, I used to flip between these two camps, where I'd often have a week where I just couldn't sleep, and it was absolutely awful. So why is this happening? Could be a number of different reasons. Pain, anxiety, overstimulation of the sympathetic nervous system, sleep disordered breathing. So if we're breathing through our mouth in our upper chest and shallowly, then our sleep, if we are sleeping, is not going to be good quality sleep. We're going to be more likely to wake up a lot, and we're certainly not going to get down into that sort of deep rest where we're going to wake up feeling like we've actually had a good night's sleep. So if we can improve our overall, if we can improve our overall breathing, then we can massively influence how well we can sleep. So making sure that we are nasal breathing at night. Now, Vicki's already said that if we are nasal breathing during the day, then we are more likely to be nasal breathing at night. But one of the big turning moments for me was starting to use mouth tape at night to allow myself to actually nasal breathe. And the first time I did that, I remember waking up the next morning and going, whoa. I mean, actually, that wasn't what I said. What I actually said is not repeatable right here. But it was like literally night and day for me. But it wasn't something that I could do to start with. So I had to actually sort of build my breathing up before I was able to mouth tape. But that's certainly something that can be really, really useful for people. Things like pre-sleep routine, you know, we love to hear about things like sleep hygiene, and these things are helpful. Things like getting outdoors in the morning to sort of kickstart our circadian rhythm. But if we have dysautonomia, often we can't do that because we can't get up in the morning. So, we focus on what we can do. And if we can do some of these things, then they will help at least a bit. So things like sleeping in a cool, dark, and airy room, things like reducing blue light and screens and things, an hour, a couple hours before bed if possible. Things like using lamps rather than sort of ceiling lights. I don't know if there's an actual word for them, spotlights and things. So in the evening, put the lamps on instead of that. And things like food and alcohol are also big factors. There's actually a quote that Vikki found the other day that says, "Sleep has become the new frontier in improving sports performance, with increasing numbers of athletes turning to sleep experts and breathing coaches for guidance." So it shows how important sleep and good quality sleep is for movement. And I can tell you from personal experience that it's extremely important for long COVID as well. So we're going to try, if you're feeling up to it, another wee exercise here. So as we said earlier, if you are not feeling up to it, then please don't do it. If you're struggling, then maybe just focus on your nasal breathing instead. Okay, so left nostril breathing. So if you would like to, feel free to close your eyes because I'm going to kind of read out what's on the slide anyway. Or you could look at the elephant who is sort of very happily breathing there in a quite relaxed way. So if you are able, you can gently cover your right nostril with a finger. So there's no need to sort of pinch it too tight. Literally, all you need to do is just cover it with your finger. And then inhale through your left nostril as slow as you can, but not so slowly that you're going to feel stressed by it. And then just exhale again through that left nostril. So you're just going to be breathing in and out through that left nostril. And the reason that this is helpful is that it is directly related to the parasympathetic nervous system. So our left nostril, let me get my lefts and rights correct here. Our left nostril is related to our right brain, and our right brain is where we're getting all of that rest and digest that we were talking about earlier that is so important in recovery. So if you've heard the story about step to the right, then that is what we're attempting to do here. We're attempting to get out of our left brain, out of that fight flight, and into our right brain where we can relax, rest, digest, recover, allow our bodies to heal. So this is a really quick way to activate that rest and digest response. And linking back into what I was saying just a moment ago, it's a great one to do before you go to sleep. So one of the things that I used to find quite useful was to try and do something like a yoga nidra before bed. But, sometimes I couldn't be bothered with that. Sometimes I was tired. I just wanted to go to sleep. And, the best of intentions, it takes a bit of kind of energy and thought to do something like that. So, if that doesn't appeal or it seems like a bit too much, actually just doing a little bit of left nostril breathing as you lie down or before you lie down to go to bed can be a really good way to sort of knock your body into that rest and digest where you're going to get better quality sleep. And better quality sleep means better quality healing for our bodies. So while you're carrying on doing that left nostril breathing, have a think about how your body might be responding. So what do we want to look for in these exercises? Okay, when we're doing something, especially when we're very fatigued, we want to know that it's actually making a difference. So if I'm going to do this exercise, how do I know that it's actually working? So hopefully what you might be feeling is a bit of increased saliva in your mouth. So again, that's going to show you that your rest and digest has been activated. You might be feeling slightly warmer hands and feet. So this was something that I found really, really helpful because I had terrible circulation in my hands and feet. You might be feeling your stomach rumbling, sort of gurgling away there. Again, that's our digest response kind of kicking in. You might hopefully feel some reduction in your symptoms if you're symptomatic. Notice your breathing and heart rate slowing down, and just an increased feeling of calm that's kind of hard to describe if you until you kind of experience it. So just focusing on that breath can hopefully really allow yourself to just hopefully get some of these effects. And if you're not feeling them right now, that doesn't mean that you're doing it wrong. It might just take a little bit longer, might just take a few more tries. Okay, so here we go, everyone's favorite word. So pacing is really hard. We're trying to pace our physical activity, we're trying to pace our cognitive activity, and then we're trying to pace the other things that are a bit less predictable, like emotional responses to things. One of the things for me was having an argument with my partner, which you can't really predict. So now, on top of that, we have to pace our breathing exercises. So what we want to do here is we always want to finish with gas in the tank. Okay, so we never want to be pushing ourselves to the point where we think, gosh, that was a lot. Okay, so could you do that whole thing again? And if you think you could, then that's probably a good amount to have done. If you think, oh my goodness, no, I definitely couldn't have done that again, then that may have been a little bit too much, and maybe next time you want to do a little bit less of it. Okay, little and often is going to be better than a longer session. Okay, so back in my previous existence teaching music, you'd get the classic thing where the child or the adult would go, oh gosh, I've got a lesson tomorrow. I'd better do 3 hours practice tonight, which really isn't a particularly successful thing to do. Whereas if they'd done 10 or 15 minutes every day, then they might have actually seen some progression. And it's kind of, I'm being silly, but this is kind of a similar thing here. So if we're able to do 5 minutes a couple of times a day, then that is what we're really looking at here. Trying to do like, oh, I've not done any breathing exercises this week, so I'll do like an hour. That's gonna potentially push us into something place we don't want to go. Don't give up. Okay, breathing exercises are, I was going to say a marathon rather than a sprint, which is probably not that's a bit of a rubbish analogy, but you will notice improvement over time. What you may not notice is improvement the first time. If you do, that's great. I mean, hopefully some of these exercises we've done today, you will maybe feel something from them. That would be awesome. But if you didn't, don't feel like, oh, well, breathing doesn't work for me. Hopefully over time, you will start to see improvement. And then the other thing, you can increase or decrease the frequency and the timings of all of these things at your own pace. So, if you're having a good day and you think, actually, maybe I can push that one a little further, then great. If you are having a day where you are really not feeling so good, then, knowing when to back off, or which particular exercises to do. Definitely for me, it was knowing which ones to do on the days where I wasn't feeling good, and then which ones to do on the days where I was feeling better. As we've been told a million times, remember, listen to your body, because it is probably telling you what you are able to do on that particular day.
Okay, just to sum up, when should we be nasal breathing? So we should be nasal breathing during the day. We should be nasal breathing at night. And if we are able, we should be nasal breathing during movement and or exercise. So the bottom line is that your day-to-day breathing is the foundation upon which your breathing during movement is built, and it's the foundation upon which your sleep is built. So I can't stress enough how important it is, if you take one thing away from this seminar, that you nasal breathe as much as possible. So often, as Jackie just said, we tend to overdo things, but this is something that's very doable. We have to get in touch with what we're doing right now, and if we need to change it. But my thing is, it's more important to nasal breathe throughout the day and not do any nasal breathing exercises than do the nasal breathing exercises, but then mouth breathe for the rest of the day. So that's kind of our takeaway from this. Focus on your nasal breathing. I hope we've showed that nasal breathing will support your long COVID recovery. It will support you on good days and your bad days. And also that it will help if you are an athlete and into more of the movement. So they go hand in hand. And that's one of the things that we wanted to explain, that used properly, you're going to get benefits in both arenas. All right, so now we're going to have just a little, we're going to put this out there. Jackie and I have been working with long COVID patients. We've been asked about putting courses together for patient or for people with long COVID, focusing on breathing. And I'm also going to talk about a breathing course for athletes who have long COVID. So what we've talked about today is literally the tip of the iceberg. We've given you 2 exercises. We've talked about nasal breathing. And, if you walk away and nasal breathe and do the left nostril prior to sleep and the diaphragmatic breathing prior to sleep, you are going to see an amazing change in your health. But some people want to dig deeper. I know it's something that I wish I had learned as a professional athlete. My performance would have been so much better. And it's something I wish I'd learned at the beginning of my long COVID journey. So what we're doing is we're taking kind of the trial and the error. We've all been guinea pigs. I know I certainly was, for a lot of breathing exercises. So we've taken the trial and error out of the breathing exercises, and we're going to offer a 6-week course, 12 sessions, that's going to be starting on Monday, the 6th of November. So like I said, there's 2 separate courses. There's one for people that have long COVID and feel like they just want to focus on the breathing for long COVID. And then we're also going to have one for people that are athletes, but are also suffering from long COVID. So it's a tool that you can use on your good days and the days that you get out and you're able to move. It really is a recovery enhancer, and it's a performance enhancer. So we're inviting you to kind of join a community, because we're going to coach you. You're going to learn exercises. You're going to practice exercises. We're going to kind of hold you accountable, but we're not going to push you. We're going to develop a program for you, give you handouts, give you worksheets, offer a little bit of support and community. But as coaches, we want you to learn a practice for yourself, a practice for each other, just a practice that you can use to help with your individual issues. And that's what this course is all about. So we're going to keep it nice and small so we can offer individual attention. This breathing really is an amazing tool. It's an amazing tool because it can help us on our bad days. It's a life tool. We're going to use it after we have recovered from long COVID. And it's something, that recovery is something that I think we all have to believe in.
Thanks, Vikki. So just to follow up that, tomorrow morning, well, morning for me, I will be sending out a few links, including a copy of the recording, for those of you who weren't able to make it or maybe needed to leave early, and also a link to sign up for that breathing course, or for both of those breathing courses if you are interested. We would be really, really excited to have you join us. There's also our social media links on the screen just there, and our email address, longcovidbreathing@gmail.com. If you have any questions about the course or anything else, please do shoot us an email and we will get back to you. So I think that's all of that. There are some questions in the chat, so I might just get rid of this screen and we can dive into some of them and see if we can provide some answers.
Okay, I'm going to go to the top of the screen, see if I see some questions. When I lie down, the pressure in my nose is greater and my airways through the nose are smaller. This makes it tricky to breathe through my nose at night sometimes. If you join our course, we're going to be doing some nose unblocking exercises. Often we do feel congested when we've got long COVID, and often we feel more congested when we lie down. So having a certain exercise that you can do to unblock your nose is often very good. The other thing is just to focus on that nasal breathing during the day, because sometimes to nasal breathe, we are able to open up those airways. And the more we nasal breathe, the better our sleep routine is going to be. And I think we've posted a couple of videos on our Facebook page, Breathing from COVID, about mouth tape. So we didn't talk about it here, but mouth taping allows a certain amount of breathing if you need to do it in an emergency through your mouth, but also it encourages you to nasal breathe at night.
Okay, there's one here. How do you practice or do diaphragm breathing while talking? I know I chest breathe and don't know how to change habits. Yeah, it's difficult, isn't it? I mean, one way to change habits is just to practice. So over time, I also know that for me personally, when I get anxious or when I get excited, I talk really fast. And when I talk really fast, I'm pulling in air through my mouth. You know, that thing where you're sort of that kind of response. So one thing, diaphragm breathing can be actually a very good public speaking tool, because if we are diaphragm breathing, then we are breathing through our nose, we are breathing slower, and we're taking time in between things that we're saying. So, you know, we can speak a sentence, for example, then breathe in through our nose and activate our diaphragm before continuing on. So again, we're actually going off on a massive tangent here, but for somebody who was public speaking, for example, that's actually going to hopefully decrease any anxiety that you might have around performance or speaking or anything like that. I went on a massive tangent there, but I think that hopefully sort of answered the question.
And I was going to add something to it. The important thing is, you know, the diaphragmatic breath is actually one of the exercises that we use. So to actually be diaphragmatic breathing while we're talking is quite difficult, because we're actually focused on our talking and not on our breathing. So it's what you're doing in between the time when you're talking and eating that is important. So returning to that nasal breath once you finish talking, returning to that nasal breath once you finished eating is the backbone of learning to breathe properly. And I would add to Jackie's comment, you know, just to before you start talking, is to do a nasal inhale and exhale.
Yeah, definitely. Recommended length of time for left nostril breathing. It's going to depend very much on the person. I would say anywhere from two, 3, 4, 5 minutes, maybe. If you're starting to feel stressed in any way or tired or anything, then absolutely stop at that point. Very much listen to your body on that one. I don't know if you've got anything to add to that.
Yeah, all of to be focused on what you are, what makes you feel good. So we can sit here and say, you know what, it'd be recommended that you do 2 minutes. But you know, the lovely thing about left nostril breathing is if you feel like you're beginning to get some air hunger or feel a little suffocated, just remove your finger nostrils and calm yourself down. You know, it's like jumping immediately into a 5-minute nostril breathing might be too much. It might be something to work up to. And it's the same thing with the diaphragmatic breathing. You know, if you find that you're not achieving what you want to, take a rest. You know, this is about you. This is not saying it has to be done for 4 minutes to achieve that sympathetic switch. It doesn't. It needs to be achieved or the time needs to be achieved so you feel comfortable doing it, because we want you to come back to this.
Absolutely. Do you see diaphragmatic pain in people with long COVID who are mouth breathing as opposed to nose breathing? Ooh.
Yes, we do. We do. What happens is it's all part of the muscles, and when we are mouth breathing, then those muscles around our diaphragm, the intercostal muscles, they just don't get used. So then when we start nose breathing, using those muscles, it's like, hello, you haven't been using me and I'm sore. You know, we all know what it's like to get up from the couch after we haven't moved. You feel soreness. You know, the diaphragm is exactly the same. So once again, these exercises are to be taken at a certain pace. And, you know, your diaphragm is a muscle. Your rib cage has muscles between them. and they will be sore if they have not been used. So that's why we say exercise these muscles with caution. Do these exercises with caution. Don't do more than your body can actually utilize.
Yeah. Wow, I wonder if there are any studies on type of breathing and incidence of COVID infection. I suspect not, but I think we can probably predict the outcome of that. But it would be very interesting, wouldn't it? Right.
I know one of the questions that I got was about the length of COVID recovery, long COVID recovery, and also the intensity of like relapses or what we call episodes. And I can tell you that my relapses have gotten less severe and further apart. And I'm focusing on my nasal breathing all of the time. So I think that's, those are the kind of things that we want to share with people, that, we don't know what your journey is, but we can tell you from personal experience, if you can take this on board, that hopefully it will make your day-to-day living a little bit easier.
Okay, there's someone here who is talking about, right, tongue's a little bit too big, cheeks and mouth are too small, and tongue can tend to push against teeth. This is information from a dentist. So basically we're talking about people with this sort of physiology, can they learn to breathe normally? My tongue does feel like it can block off my airways. I've managed to get my tongue into the top position since we started this exercise and have been nasal breathing for a good 20 minutes. That is awesome.
There are professionals out there called myofunctional dentists. And a lot of them work with Oxygen Advantage and Butico, because they understand the importance of proper breathing on the mouth cavity. But a myofunctional dentist would help with the issue of your mouth. And they would be able to give you exercises, because there, believe it or not, are exercises for your mouth that would improve your nasal breathing and the our different anatomies of mouth. So I think you can look it up on certain websites, but I know of many.
Yeah. Are we going to learn how to make our bodies more alkaline through breathing? I think the optimal, is it pH of 7.35 that we're aiming for? I think Vikki will be able to correct me if I've put the wrong numbers in there. Yep. Is that right?
Yeah. So what we're going to learn in the long COVID breathing techniques for athletes is we are going to learn how our breathing can affect the pH of our body. We have so much to teach about breathing and exercise. We can, but that's one of the things, and I mentioned that in the talk, how we can influence the biochemistry of our body through breath. And also things like spleen contractions, the PO that gets released from our spleen, we can increase that by doing certain breathing exercises. So there's a myriad of things that will be focused specifically on that course, or that will be addressed in that course. And that's, I can see one of the questions, one of the differences between the two courses. Jackie, do you want me to
go for it?
Talk on that one? Okay, so there's two different breathing courses. The one for breathing for long COVID. Here we are teaching more of the what we call Butico. Butico breathing focuses on medical issues like asthma, heart disease, sleep apnea. Help me out, Jackie. So
sleep,
definitely snoring, all of those medical issues that can be helped with breathing. So long COVID goes right into that course. The other course is focused more on what happens to our body when we start moving, i.e. exercise, and how, but how we can also improve to help with our performance, our recovery, and our day-to-day training, if we are able to do that. So we have said it might not be something that we can do right now. Information about that as a tool for the future, and that's what we wanted to differentiate between the two courses, knowing that there are categories of long COVID.
Perfect. Someone's saying when they walk, no, yeah, forgetting how to walk and breathing at the same time. Yeah, too many things to think about. If I think, you know, maybe you could do breathing exercises not walking first. So try focusing on some of these things, either lying down or sitting, and then once you're a bit more happy with that, then start adding in things like movement if you're able to do it. What I find sometimes is that I'll be sitting at my computer focusing on something else, and you know, oh, I'm chest breathing, right? Okay, let's sit back. So you know, it's like a habit, isn't it? It's like we have to keep reminding ourselves until it really becomes a habit, but also remembering that actually when we get stressed, whatever that stress is, then that is when we may fall back into our dysfunctional patterns. And that is why, you know, when we are able to use the breath to influence that, it can be such a powerful tool, because everybody gets stressed. You know, even once we're off into the sunset and we're all recovered, there's still going to be stress in our lives. So knowing how to be more resilient to that and how to deal with it when it comes along is going to be something that's, you know, like we've been saying, it's a tool for life. I think there's one more.
It's also one of those things. Oh, I was just going to say about long COVID. It's you know, we have brain fog. We have we are forgetful, and sometimes I have to write myself note to say, breathe, smile, whatever it is, you know, focus on that nasal breathing. Sometimes I'm out walking and I will find that I have reverted to a mouth breath. Now, if that's happening, one of the things I would invite you to do is just to ask yourself, am I actually walking too fast? Because overdoing that, have not been able to nasal breathe and walk, indicates to me that you are, or that we are, actually exercising at a level that is not good for our long COVID. So, you know, a reminder to set yourself is, if I'm going to go for a walk, I need to keep this at a level where I can continue to nasal breathe throughout my walk.
Yeah. Okay, when I lie down, the pressure in my nose is greater and my airways through the nose are smaller, which makes it tricky to breathe through my nose at night sometimes. Yeah. You could try a couple of things. Personally, if I find that, then putting an extra pillow under my head can help. And also something called a nasal dilator could be useful. As well as doing some of these exercises before you go to sleep. I think Vikki's got something else to add to that.
Sleep on your side, not your back. Sleep on your side, and actually what happens is when your sleep pattern shifts throughout the night, or your recovery pattern, you will find that you will switch from being dominant on one nostril, dominant on the other side. So it's important to sleep on your side rather on rather than on your back. Also, sleeping on your stomach is also fine.
Yeah. Okay, one final one. If you think of any more questions after we've finished as well, you can fire them to our email and we'll do our best to answer them there as well. Have you found any type of breath work in particular to help with persistent chest tightness? I'm quite a functional breather throughout the day and night. Yeah, persistent chest tightness was something that was a symptom for me that lingered and lingered and lingered. Personally, the diaphragmatic breathing was the one that I found the most useful for that. I don't know if that's a personal thing or if that will work for lots of different people, but I found that if I was getting chest tightness, it might have been that I was getting anxious about something, which was something that happened quite often because you can get quite anxious with long COVID because it's not a huge amount of fun. So if I was doing that, then I was probably shifting into chest breathing, or certainly partly chest breathing. So if I was really, if I noticed my chest getting tight, really focusing on getting the breath down to the bottom of my lungs was something that I found really, really useful. And even if it wasn't something caused by anxiety, then just focusing on the bottom of the lungs was really, really helpful for that as well. I don't know if Vikki has anything to add to that one.
I do have something to add. The other thing about the anatomy of the body and our breathing through our nose is when our scalenes, and they all hold up certain muscles. So often when we get chest tightness here, it's because these muscles are in a state of contraction. They're causing this. And one of the things that we need to focus on is that postural change and increasing the strength of our core, because then that takes a lot of pressure off our chest. So this is all connected. And so when we get tight here, it pulls on this tightens up, and then actually our diaphragmatic breathing muscles tighten up. So it's just working, keep working. You can also do a little bit of self-massage, but even doing that while your diaphragmatic breathing would certainly help.
Yeah, absolutely.
The other thing is with these questions, we have a Facebook page and we love getting questions about breathings because it gives us inspiration for do videos. It gives us inspiration. If we don't know the answer, we will go and find the answer. We have great connections with Patrick, who's been a huge help for both of us. But if it's a question that you have, usually it's a question that someone else is having. So feel free to contact us with any questions. Get to answering them and put them out there either on our Facebook page, Instagram, or I think we've got a YouTube channel as well.
Yep. Absolutely, yes. Yeah, we like questions, and if we don't know the answer, that's actually quite exciting because we like going to try and work them out. Cool.
Yep.
Right, it's getting on for 6:30 here in the UK, so I think we probably better call it at that point. Thank you everybody so much for joining us. It's been really fun putting this together and sharing it with you and answering all of your questions. So I'm going to do another drop of those two links into the chat, but don't worry, we will also send them out with the recording and everything in the email tomorrow. So don't feel like you have to try and scrabble around to grab them now. So yeah, I think on that note, thank you so much for joining us and have a good rest of whatever part of your day it is.